My computer clock is down, so I'm assuming it is now 11:30. It was just about. So I'm going to call the Opioid Settlement Fund Task Force for November 6, 2024 to order. Second item on the agenda is roll call. Please, clerk.
Chair Strebs.
Present.
Chair Ray. Vice Chair Pro Tem Hepler. Commissioner Morales. Director Rutherford.
Here.
Dr. Nettleton.
Here.
Director Bobo.
Here.
Sheriff Fuller.
The election did something to you.
Administrator Green. Director Darnell.
Here.
Administrator Davis.
Here, but I'm not an administrator.
Oh, okay. Nicole Stortaboom.
Here.
Dr. Ford. Brenda Henry. Nancy King.
Here.
Dominic Gladstone.
Present.
April Anders. You have 11 present.
Thank you, clerk. Next item on the agenda is the review and approval of our minutes. I would entertain a motion for review and approval of the October 2nd, 2024 draft meeting minutes.
Madam Chair, I would move to accept, but I have a question. There was something on the last page that said we would be discussing, bring ideas or comments to discuss and add to the board recommendation at the end of the section on mini grant schedules, and I didn't see it on the agenda. So I just want to call that to your attention. I don't know if we need to discuss that today, but I move to accept the minutes.
Thank you. Is a motion to accept the minutes as presented. Is there a support?
Support.
Was that Dr. Nettleton? Who was that? Who said it? Thank you, Director Bobo. Motion made by Mr. Gladstone, supported by Director Bobo. Is there any further discussion? All those in favor signify by saying aye. Aye. Any opposed? Motion carries. The minutes are approved. Thank you. We'll move to item number 4, which is an opportunity for public comment. This is a place for members of the public to address the task force. You have up to 3 minutes. You can come to the podium, or any members who wish to participate online. Seeing no one coming forward in chambers, Dina, is there anyone wishing to interact online?
Chair, there are no hands raised.
Thank you so much, Dina. We'll close public comment. We'll move on to item 5, which is discussion. And we have been provided with a draft of the reconciliation, or the recommendation rather, report. And I'd like to now open up discussion. I had an opportunity to make some notations through my draft document, but I'd like to hear from others. And Mr. Gladstone began our discussion today, just elevating from the prior minutes, how we would have some discussion around the mini grant cycle to include within this draft. So I don't know, Mr. Gladstone, if you want to begin a dialogue around that particular point, or it's open to whatever.
Well, Chair, I was going to
Yes,
suggest,
Dr.
I don't know if I'm blanking, Lindy would like to give maybe a broad overview of the document. I did review it, but maybe it'd be helpful for the group just in broad strokes before we go down into the details.
Thank you, Dr. Nettleton. So Deputy Administrator, would you please provide us with an overview?
Yes, happy to do so. So through all of y'all's meetings, I've been taking some detailed notes, trying to garner the input that y'all have had, as well as where you have made some decisions. So that's really what this document encompasses. At the beginning, we have an overview. I did include the results of the community needs assessment that was outlined on page 17 as part of that consideration of y'all's review, and then have a section in there that goes into answering the resolution questions that were posed by the Board of Commissioners. From there, I tried to incorporate some of the discussion that y'all had. Really kind of, it was hard to separate. Sometimes it was going into one question and into another, or maybe even the flow of the questions with how y'all discussed them and analyzed them. The flow was a little different. So I tried my best to keep it in the order of the questions and to keep an answer per each question. I think there's one area where I still wasn't quite certain within question 2 on concentrating funding towards opioid remediation for the next 3 to 5 years. Y'all did have a lot of discussion around the different needs, and then a little bit of uncertainty regarding within the community needs assessment, that recommendation to number 2, the support one organization addressing SUD and recovery. That question, I wasn't quite certain that I knew what direction y'all wanted to have or what your response was to the community needs assessment and that particular recommendation. That's the only area that I kind of had as a question mark. The rest of the document, though, is for sure for y'all to review to make sure what I have put in here is really what was discussed and what y'all agreed upon or received consensus of. So that's really kind of the broad strokes of that document. At the very end, I just kind of have, after the answering of each question, just a broad conclusion statement, summary, kind of laying out, this is where we are, and this is the report that we're submitting to the Board of Commissioners, or that y'all are submitting to the Board of Commissioners. So really that's the flow. Looking for what additional edits y'all may have. I will try my best to make those edits in real time if you have them, but it will be probably helpful for me to receive anything at the very end if we have consensus, just to make sure I understood completely what y'all are wanting to change or agree to. Hopefully that's a good recap.
Mr. Gladstone, and thank you, Deputy Administrator. Go ahead, Mr. Gladstone.
Thank you, Madam Chair, for the floor. Deputy Administrator Smith, excellent job on this. We've had a lot of discussion, some of it crossing over one question into another. And as I read through it, it does provide an overall flavor of all of our feelings as far as I can tell. So that's a great synopsis of what was a lot of different conversations. A few things that caught my attention. One on, I'm on page 2, question 2, in the middle here under housing resources for the recovery community, make the process for starting a recovery house easier, reducing restrictions and eliminating barriers. I think that could be a very complex issue for the county commission to address. So I don't know if there's anything we want to do as a task force to make that direction a little more clear. And just throwing that out there as a point of discussion. And the other item I would bring up is this recommendation number 2 to support an organization as a central hub. I personally have been saying for many years, going back to when I started with ROSC and Kelly's Malta from SWIMBA and that group that Gwendolyn Hooker chairs now. I've been with ROSC a long time, Recovery-Oriented Systems of Care, for those who are not familiar. If you aren't familiar, we still meet every month. We were talking about having some sort of a hub. There's a lot of information about substance use disorder that comes from various sources, and we need a way to disseminate that, not only to agency, business to business, so to speak, but also to the general public. And what I investigated was actually formation of, and some places have done this. I think Boston's got one, Oregon's got one, an office of recovery that acts as a central clearinghouse. I would like to see an independent organization so that constructive criticism can be offered. We don't want an organization who says they're the best at something not accepting criticism. In other words, there should be a third party, an outside party who can say, hey, you could do this better. Hey, you could do this better. We need to improve here and there, and be able to do that freely with it, but still have skin in the game, so to speak. So that was my thoughts on that particular piece. So those are 2 points we could throw out there to discuss amongst ourselves. And I think I had a third one. Otherwise, I will wait. Oh, the last piece, when we summarize everything, I really appreciate very much all of you using the addiction and mental health crisis language. And I think we should stick with that instead of just buying into the flavor of the month. I've said it more than once, so I won't repeat the whole speech. But let's not do flavor of the month. Let's call it the addiction and mental health crisis in our language, so that we do that and get used to it. Because that we can address multiple sub issues through these opioid settlements. Thank you for letting me share. I went on a little long.
Thank you, Mr. Gladstone. Your voice is valuable here, as is the rest of our members. I'm just going to elevate the need for some technical assistance from administration. As I don't know how many times before, I don't have a computer cord, and I can't get some feedback that I wanted to provide. So I don't know if Dina can hear, or if there's anybody that can be tagged in to phone a friend. But if there's anyone with a cord, so I could get access to my laptop, I would appreciate that. So sorry to sidetrack us. Thank you, Director Donnell. Director Bobo.
Couple of comments. I sent one of these, actually I sent them both to Linda the other day. Commenting on Mr. Gladstone's comments, I think the other option is, instead of forming a whole new entity, is to find an entity with 70 to 80% of what we're talking about here. And as the first line says, support that organization to act as a clearinghouse. I'm not sure the creation of an entity is a good use of money and personnel. I would lean towards supporting an agency that already exists and helping them. The second thing that came to mind was, during our discussions maybe 2 meetings ago, and then again in this document, I saw that the opioid educator was being leaned on heavily, frequently, and maybe too much. Currently that's Kendall, but we don't know who it's going to be at any particular time. I'm worried that all of these conversations we've had about the opioid educator, the opioid educator, the opioid educator, she can do this, you can do this, you can do this. She's already got a full-time job. And I suspect, having been with her for a few days in training, she's pretty busy. So I would like to see us not put so much on her plate that she becomes overwhelmed. My 2 comments.
Director Rutherford.
Bobo, I appreciate that. And, you know, we are continuing to have conversations with her boss as it relates to what her current position description has in terms of content. And we're very mindful of, you know, not overloading that position to, you know, diminish effectiveness. And I go back to the 2 elements that, you know, obviously that stick out in my mind are the recommendation, the 2 recommendations on page 3. Recommendation to number 2, obviously this conversation that we're having regarding a central hub office space, as well as recommendation number 3. I still think that these are pretty significant outliers in that there's a lot of work that is comprised within those 2 recommendations. And I think it's important that we have a clear direction or recommendation for the full board to be able to, you know, satisfy those. And I just don't think we're there yet. Just hearing today's conversation relative to, you know, I'm not a fan of an outside entity that's independent, because I think that there's enough expertise within this current environment to accomplish that. But the assignments need to be made, and the staffing needs have to be allocated, and people need to understand roles and responsibilities moving forward. I think that an independent entity would potentially lack, the oversight that's going to be necessary to do this effectively and to assure that there's a level of accountability. The grant management part of this it's going to be work and it's going to be time consuming, and that's coming from a lot of experience with county grants and with state and local and federal grant management. There's just a lot of work behind that I don't want to have underestimated. Thank you.
Ms. Davis.
I'm gonna back us up a little bit perhaps, but in going back to the community needs assessment, just wondering if one of the things that we can look at or recommend is that we look at other community needs assessments that have been completed to see if there's information in those that would also be helpful in guiding some of the recommendations or just further for the county. There are a lot done, Bronson, Borges, ISK. So we have a lot of needs assessments done, just if there's additional information out there that would be helpful in kind of what we have learned and where we could move forward.
Thank you for that. Ms. Henry.
So for number 2, having that central hub, I want to go back just a little bit and hopefully not to take up too much time. I remember in the early 90s when the HIV epidemic hit and they needed community educators to go into the community to provide that education. I was one of those that went through the state training to be able to provide that education to our community residents. And I really believe that if you're going to think about a central hub, it has to be somewhere that people and families that are dealing with addiction feels comfortable enough to enter in. And so what we did was we provided that within one of our community neighborhood associations, which was the Northside Association for Community Development. We had a great turnout. We would do the publications. That was the central hub. So I'm thinking, if you think about a central hub for people to be impacted, that we may be able to utilize our neighborhood associations because they're doing work within our neighborhoods. They're hosting our neighborhood meetings and town halls where people feel comfortable enough that they can come in there. It's accessible to the community members as well. As we think about the central hub, is it the Kalamazoo County Health Department? Well, that's a little bit out for people, but if it's within my neighborhood, it's accessible. And I think we have 7 neighborhoods, and the Stewart neighborhood is close to the Northside neighborhood. So they could come together and have a central hub. So those are my thoughts concerning that, is somewhere where people feel comfortable enough that they're going to utilize the service.
Absolutely. Ms. King.
I don't know if this was from an earlier discussion or not, but when I look at this statement, again, looking at the question 2, recommendation number 2, support one organization for addressing SUD and recovery that will lead communication across all organizations. It's a really broad statement of what to do. And I think that that's something that we might need to discuss more, is what does that look like? What is the purpose? What are they trying to get across? I mean, we have so many agencies that work in recovery and substance use information that adding another place might just be more confusing instead of being able to define what it is that they're doing and the purpose behind it.
Well, now I'll add here, if I may, just from those prior discussions, there are many organizations out providing care. And I think the recommendation is trying to get to that difficulty for that family or the individual need navigating that system and finding all of the locations. And there sort of wasn't a place to go to do a centralized intake that helps then with warm handoffs to the rest of the organizations they might need to interact with across the continuum of their treatment course or care. So that's I think the idea behind what they're trying to accomplish, but how, I think, is certainly a complex point. Ms. King.
I thought that's what the new Griffin Place was supposed to be doing. It's a central location people can come to. It is designed to create connections with specific organizations. When handoffs are made, there's agreements that they can follow up on that person to see if they went to it. So we should be asking what they're doing? And is that something that maybe having something that's specifically focused on, recovery and treatment, but is already being established in a community that has the oversight, that has that organizational perspective of our community that's been around for a long time?
Dr. Nettleton.
Thank you. I think the discussion on the specificity of what that recommendation is important. I think separating out in our minds the funding, administration, and oversight for grants is separate than this idea. Just want to make sure we're clear about that. And we've had robust discussion in our Kalamazoo County Opioid Coalition, about this point. It comes up a lot, and as is pointed out, it's come up in ROSC for years. And in our strategic plan at the KCOC, I'll just read you the language. It was establish or augment, was one of the establish or augment existing communication systems in order to guide families and individuals to community treatment and recovery services. So in the spirit of that, that's what the KCOC kind of established as a objective, if you will. I think that's the spirit of this recommendation here. My thoughts on this is that I don't think it should be at the health department. It really this is talking about knowing continuum of care, knowing communications, and my recommendation or suggestion would be to have it as a funding opportunity to go out into the community, perhaps with that 10% of the recovery services that we outlined and agreed upon for this. This sounds like that could be a nice bucket for this to reach that objective. Create an RFP for this specific objective around communication and guiding families and augmenting or creating something new. Augmenting probably is kind of what we've leaned on in the KCOC. Thank you. Director Rutherford, sorry.
Yeah, I completely agree with that recommendation. I think it satisfies a lot of what we're talking about. I think it addresses the need to, I agree, I don't think it belongs at the health department. I think it satisfies the need to get it out into the community, but it also assures some level of hopefully an entity that can do the work. And I do believe that if that's the route that we take, we do need to really hone in on specificity and make sure that we know what we're asking for. It's important too to keep our eye on the overall objective of trying to keep as much resource available for direct services and not get too heavy with other administrative costs. But I think that recommendation from Dr. Nettleton is a pretty good compromise that satisfies hopefully all of our interests. So thank you.
Mr. Gladstone, yes.
Thank you. Appreciate that, and I appreciate the feedback and what I'm hearing a little bit of, not from everybody, but from some, is confusion about the idea itself as far as what audience we're serving. So I'm a little latitude to explain, because there's a lot of history that led up to this, and it's finally getting accomplished in some way, shape, or form. The history was we needed a way to get the information business to business, agency to agency, from Healthy House to Cope Network, from prevention works to the health department, business to business communication as well. Oh, you're having this event. Oh, you just started this program. What's that all about? That was part of the need. So you're serving that audience, just so we know what we are doing. I want to make that clear. That's a separate audience and the reason for a hub. And now number two, the public, who says it's very difficult, having done addiction work for 20 years, very difficult to navigate the system is what I hear a lot of. People don't know where to go and what to do. And there's 8 different agencies doing phenomenal work that they have to work their way through to get where they need to get to. What I'm picturing is what and this is the easiest example I can come up with, is when Federal Express started working, they shipped everything to Atlanta. And then Atlanta shipped everything to everybody's house. They had a central hub, a clearinghouse for every single package. It's like, how do you do that? You're shipping a package from Seattle to New York. You're going to ship it to Atlanta first? Yes, every single package goes to Atlanta, comes back out, and goes to the rest. And that worked very well for them for a long time. That would be the analogy I would make for this, a central hub where all the programs and information and things go to this central hub and come back out. And you know who could run it? A communications specialist, like he's going to shoot me, but Alex Lee, my friend Alex, who's now retired, who was the communications director for Kalamazoo Public Schools for a lot of years. A guy like that could run the whole office, one guy. A journalist, a really good journalist or editor could work on it because they're taking information in and shipping it back out. I'm not picturing a resource center where people are dropping in off the street or anything like that. This is more of a news organization, the CNN of recovery, this hub of information. That was the original spirit of the idea. We've deviated and compromised and gone off into different directions. Now, who should run that? I do believe it should be somebody independent so that they can provide constructive criticism when there's lack of communication. And if you have an agency that already exists, how do they criticize themselves? You need to be able to have somebody say, you're not doing it good enough. You need to do it this way, or make suggestions. That would be the oversight part, is being able to look at all this and say you're doing a good job or not. Does that hopefully explain? And if anybody is misunderstanding before we go off into different subjects, does everybody understand clearly what I've described? Is that yay or nay? Do you understand what I'm getting at? Because that's where it came from. Years of dealing with this with Roskin, then with the coalition and so forth. Thank you.
The specific recommendation is also gleaned from the data and feedback from the community needs assessment. And I think I understand the gist of what you're discussing. I'm just trying to picture then, as the person that needs to be a beneficiary of services, how do I know that's the place I go to get my information, or how do they get it to me? And isn't somewhere like ROSC right now where the organizations should be sharing with each other the work that they're doing, so that the organizations are sort of informed? And then Brenda could say to someone she's serving, oh, but I know about, this service for families over here, for your cousin that you just brought up to me or whatever. So I don't want to maybe duplicate that organizational dialogue, but I'm having trouble envisioning how the individual person knows to find this office suite, or that office suite gets emails to me, or how do they communicate with me?
That would be back to the ship it to Atlanta FedEx concept. In other words, if Nancy has a new program where she's got new Narcan boxes going out, ship it to the center, and then it goes out to all of us. And if you've got a new home you're opening up and having an open house, make sure they get the flyer and send it back out to the public. Now, what we would need is some sort of an end user communication system of some sort. We thought a website, an app, but that may not serve everybody. So that part is up for discussion. I think we came up with a splendid idea to put out an RFP, and let's get some creativity going on how we would execute this perhaps. But it all ships to the center and goes back out. So you would tell the public, hey, you go to, you look here to get that. Now, what here is, I don't have the answer to at this moment, but you need to tell everybody in the public, get the word out, look here. And if that's a website, if that's an app, if it's a combination of a paper newsletter and an app, I don't have that answer. And that's what the RFP might ask for. Looking for creative ideas to create a central hub of communication. I really think a journalist would be an ideal, somebody who's an addiction specialist journalist, but that would be, the idea.
Thank you, Mr. Gladstone. So I think we've sort of tracked around this a couple times. Did you have something to add there further, Ms. King?
I'm just sitting here picturing myself as I have done in the past, an individual going, I need help. And what am I going to do? I'm going to go to Google and I'm going to go Kalamazoo, whatever. And I'm going to get 1,000 things. So even if we have one central thing, finding that thing is going to not be an easy task. I mean, I just had somebody who was looking for recovery services that I've worked with for 4 years and didn't want to burden me with finding recovery services. Typed in Kalamazoo recovery, found place, immediate openings, and it was California. So I'm thinking, and I know what I went through trying to find resources. People are going to go and just type in the internet. So it's that connection on that internet. First things that are going to come up are sponsored things, people paying for it. So maybe that's what we pay for. So it becomes number one. But I'm just trying to visualize how the average person's going to find this to be able to get the help that they need.
Yeah, I agree with that, that concern. What other feedback do we have? We want more dialogue here around recommendation 2 within the needs assessment. We want to have additional dialogues.
I'm in favor of throwing it into an RFP or something. We write it as a separate item and see if we get creative ideas from the community.
Yeah.
Thank you.
Good, thank you, Mr. Gladstone. All right, I'm going to, I have Deputy Administrator Smith, I have some just maybe structural things or to provide feedback on about the manner we structure the report that can be provided separately. I did have a couple of other areas on recommendation 3. I had just highlighted, and I think that just means I'm trying to maybe glean a little further discussion from our body here. Recommendation 3 for the community needs assessment, that first bullet says this reporting the outcomes that could be achieved by county dedicating staff time, financial resources to update the website. And then on establishing a reporting tool and evaluation tool for settlement fund programs. So that portion there, I wanted to track back to some of the dialogue we were having around what reporting mechanisms we were going to use. We had some general dialogue around trust-based philanthropy and the pros and cons of approaches like that. But when we're thinking about establishing a reporting tool, are there any other recommendations we want to make to the board about how to help this be concrete so we can see outcomes, but also that we're not overburdening recipients of funds? And if my question doesn't make sense, then please ask me to clarify. I'll do my best. I am on recommendation number 3. We're in question number 1. Recommendation 3, which is the response to the community needs assessment. I don't have page numbers. It's the second page. Page 2. It further goes on in that bullet to end with the task force recommends defining where ownership lies within Kalamazoo County government, within the granting process, contract management, compliance monitoring, communication updates, and financial oversight. So we heard sort of the concerns elevated about how much gets burdened into HCS. Do we have additional thoughts? So we recommend defining where the ownership lies, but are we just going to ask the board to define that, or do we want to make some recommendations? Dr. Nettleton.
I would keep it simple and so as long as it aligns with county policy and procedure, and then maybe just ask the Michigan Association of Counties, Amy Delinky, and say, hey, what are other counties doing? I'm sure there's already a wheel that's been created, and a form, because other counties throughout the nation and our state are already going through this too. And we may find a nice example that we can draw from and use as a template and example that aligns with Kalamazoo County's policy.
I will just share on that line with the Michigan Association of Counties. They were portion of a co-presentation at the Coming Together conference that I was able to participate with them, and they provided some overviews of the strategies used across the state. And we're really engaged in a very robust sort of planning process that a lot of communities are not engaging in. And so I think the benefit of this body is that we're just trying to elevate that perspective of folks with lived experience. And so just trying to hear whatever feedback, and I think feedback from Mac is also good, but if there is any to garner here, that's an important part of that cycle of planning.
Were you asking about the reporting part, right, of the grant, right? The reporting?
Yeah, so here in recommendation 3,
Yeah,
and that sort of the end part of this bullet, the task force recommends defining where ownership lies, then Kalamazoo County government with the granting process, contract management, compliance monitoring, communication updates,
yeah.
which we've just been sort of talking around communications, financial oversight. And maybe I'm getting way too in the weeds for the task force. I'm open to that feedback as well. Deputy administrator, I don't know. For you with that recommendation, is it something that this is a recommendation going back to the board. So are we asking them to define those roles within government, or is it something that we want that you've already had some dialogue around, with the departments?
Yeah, I think there's one thing that we've been talking about within or that I've been talking about with County Administrator Catlin. The board did approve a management analyst position, and right now, without us knowing the exact workload of all of this implementation, I think there's a lot of question marks around. Is this a full-time position? Is it a part-time position? Is it full-time initially? And then once things get rolling, especially since y'all are proposing multi-year funding, would this just be a part of someone's role? So we've been talking about potentially that management analyst position, this could be a component of that, and handing off some of the duties that I've been doing. So that's an option that we could look at and talk to the board with, and a position that has been funded by the board for fiscal year 25.
Thank you. Another item I just wanted to seek some clarification on from administration. That same page, in addition to the needs assessment recommendation, the task force recommendations, the second bullet talks about the investment funds and goes on to discuss reviewing with the treasurer's office investment options. Have we had any of those sort of initial discussions yet?
Just very broadly, we haven't circled back with them. I believe that Deputy Treasurer White, I think that question came up, or something to that point came up in his last financial report to the board. And he indicated, they could set something up if it is directed to them to set something up, just much like they did with the Brownfield Authority. So not specifically have we had further dialogue, but I believe it's something that's definitely possible if that's the direction the board would like us to take.
Good, thank you. Vice Chair Pro Tem.
Thank you, Chair. Sorry about being a little late. Too many meetings to go to anymore. I think reporting is very critical to, and going back to what you're talking about, so we know what's going, as some of what Mr. Gladstone alluded to, that, you know, what's working, what's not. And as this funding is limited, and I think it's great that that we're talking with, trying to facilitate expanded use by investments and creating some additional monies that might expand this out for much bigger and stuff. But I think reporting is going to be very critical, and maybe we can work with our possible new person to create a reporting system that's less burdensome, but does provide the information that we need to move forward in creating more services in a longer duration.
Thank you. Mr. Gladstone.
I agree that the reporting is crucial. You want to know what's working and what isn't, so you can plan for the future. Just keep in mind that we want to make sure our recommendation is clear, that we keep it easy on the organizations that don't have a lot of staffing. There's a lot of organizations that only have 1 or 2 people. And that speaks to also the low barrier granting process, to make sure it's somewhat easy for the smaller organizations to apply for money. So to apply for it, to be able to use it and say, here's what we did, and report back in some sort of simple fashion. And where the ownership lies, backing up to that point, I think that's something the Board of Commissioners needs to discuss amongst themselves. If they can handle it internally with employee coverage, or if they need a third party, like we use the Kalamazoo Foundation to get some money out there more quickly. How that looks, I don't know that we are the correct body to make that recommendation. I think that they need to figure it out, how they're going to administer all of it, because there is quite a bit of paperwork going in and coming back out. Thank you.
Ms. King.
Also, I know some of these grants may be really large. Often there are reimbursement grants, and then there are grants that are just outright, here's the money, do what you do, then report back to what happens. And I don't know if that's been discussed or not. I just know, having gone through the Ampli Fund and using the system in the county, is very burdensome for people who are having to do it on a monthly basis in order to report if they're asking for funding for staff and stuff like that. It's a very cumbersome, difficult to navigate, to make sure you have all those pieces. And when you do it wrong, you have to reach out to Mr. Kaplan and say, how do I fix this? And I think that that's something we need to think about too, is how that reporting piece is going to be done.
And elevating those 2 types of awards, whether they're reimbursement basis or an upfront funding, do you have thoughts on, what's of value there?
It's nice to have it up front when you're trying to do it, as opposed to, for a lot of startup organizations, they don't have income to begin with. So you're having to pay after you spend the money. And that's a little challenging I know that for us, it took us a long time to get to a point where we could be okay with the fact that we have a grant that's supposed to start in September, that we don't see funding till November. How do you pay staff? So that's a real concern when it comes to the reimbursement type grant. I know the larger the money, the more obligation there is for oversight to how that money is being spent in that year or multi-year. So it might depend a little bit on, the cost or the amount that they're applying for. But I think if it's going to be a reporting system, it needs to be something that's easy to do. I know, I wear a lot of hats, and adding something that is something I have to do every single month to get the funding, that requires me to go to 5 different places in the grant or in the reporting process to make sure I have all the details, is challenging. So we need to think about what that reporting system is going to look like.
Some of us had the joy of playing with the Ampli Fund system, so we empathize. So another area I had as well in question number 3, our response in question 3, we break out sort of general size of the buckets of funding: 50% to treatment, 20 to prevention, 20 to harm reduction, 10 to recovery. And then below that is a statement, it's a recognition that some funding may be needed, allocated for data gathering, reporting, project evaluations, future community needs assessments. Funding allocations for those are not currently accounted for in the percentages outlined above. Do we want to provide any guidance to that? I mean, do we want to include it in the percentages above? I know the settlements will sort of stipulate how much money we can spend, not directly on treatment, recovery, prevention, which is Deputy Administrator clarify, is it like 10, up to 10%?
Every agreement's different. We do have to report separately on each agreement, but it's anywhere between 5% to 15%, depending on the settlement agreement.
And I know overall, we'd like to see most resources go directly to, programming and services for people. So is the, I just wanted to elevate that when I read it, that was a question for me. If we want to provide any additional guidance to the commission on that, do we want to set a certain amount that we think is appropriate or a percentile, or are we comfortable with where it is at?
For administrative part of execution?
Yeah, just that statement in question 3 underneath the percentages. You see where
Task force recognizes some
Correct.
fund.
Yes.
Right. Yeah, I think a lot of organizations, I'm sorry, I'm just jumping in here, but I didn't see anybody else's mic hot. So I see a lot of organizations struggle with, okay, we've got a great program, but we can't afford to market it. Or we've got a great program, but we can't afford to administer it because of the restrictions on grants on where and how it gets used. Now, of course, if 70% of your money is going to administrative and 30% is the execution of the actual idea, that's unbalanced. But just, I would say leave some flexibility so that people can do what they need to do and not be so restrictive. A little bit of latitude. I think what we're looking for, correct me if I'm wrong, anyone in the room, but we're looking for some creativity from the smart people we have around this community with a lot of great agencies. And if we allow them a little room and a little latitude, that creativity may shine. Thanks.
Thank you, Mr. Gladstone. Oh, thank you, Ms. Davis.
So in looking at, and I don't know if we need to define it, because when I look at data gathering, that's going to be part of each one of these categories. You're going to collect data and you're going to have to report it out. If I look at, the same with the project evaluations, it's part of each one of these categories. The only thing that looks to be a little bit of an outlier on how we would fund is, future community needs assessments. And can we roll that into the other community needs assessments that are being done? And maybe partner with, I just had a meeting this morning with the new dean of the College of Health and Human Services at Western. They're looking to do some of this work. So some of these things, I think maybe we, in definitions, include it into the categories we already have.
Thank you for that. Chair Ray.
Thank you, Chair. So I agree with that. However, when we talk about data gathering and reporting, you can't write that for in the same grant as treatment. It's not considered the same thing. So my thoughts are, do we want to just put these categories together and then do an admin line of 5 to 15%, whatever that is. And then the rest goes to treatment, prevention, harm reduction, and recovery. Just thinking about some of the applications that we just looked at for the mini grants. There were a lot for recovery, harm reduction, but not a lot for treatment. So then where does the money just sit until the next grant process? Or does it just make sense to put them all in one bucket and then admin separate?
Dr. Nettleton.
I guess it's more of a question, maybe a comment, or for those with more experience, but isn't this kind of administrative overhead just as kind of a part of doing grants and just as part of having an FTE and part of being a nonprofit? If that's the case, then isn't that, I mean, you're getting the grant and then I think it's just part of the overhead of executing it. That's the part I'm missing about why we need to carve out something specifically. Maybe Deputy County Administrator Smith, who I got the title right this time. I couldn't remember in the moments.
Thank you from the chair, Deputy Administrator.
Yes. So maybe it will be helpful if I clarify this a little bit. I believe what this is looking at is, again, looking at that staff component that's sitting within the county of, yes, things are going to be granted out. There's going to be, reporting requirements coming in, whatever that is decided. There's going to be invoices coming in if it's a cost reimbursement, whatever is decided. So I think this is looking more at, okay, if y'all are granting out to 20 organizations, just throwing out a number, who is then compiling that data, who's gathering that data, compiling a report, looking at project evaluations, and looking at, okay, future community needs assessments, so going out and getting quotes. But I think it's looking at it more from that global aspect and not necessarily from each of the people receiving the grant.
Thank you. And why I wanted to have the dialogue here, because we're going to make a recommendation about a general amount of budget that we think is going to go out into community groups. And I don't want to see us sort of then have to, oh, no, we don't have that much to, we're going to, we have administrative costs we didn't sort of plan for. I just want us to be mindful for it. So thank you for clarifying that. Right. So based on that, Deputy Administrator, do you think within these, is there any further I mean, are we comfortable? We understand what Deputy Administrator is elevated, and we'll let the, board determine what that administrative set aside is going to be, and then the rest is going to get allocated out into the percentages. Okay, thank you. Not to drag that over and over through the mud.
Madam Chair,
Yes, Mr. Gladstone.
just wondering if you have the housing resources bullet point from question 2 that I had elevated earlier on your list. I don't want to interrupt you if you're in a flow, but
I do.
let's not forget that one.
Thank you for that. I did have that one also elevated. What I just added some, I gotta track back to it here a second. Okay, so Mr. Gladstone is re-elevating in our response to question number 2. The 7th bullet there is housing resources for recovery community. And I don't remember what it said previously, but I added a recommendation to consider ways to support recovery housing with the housing millage as a collaboration, and also working on intergovernmental collaboration that makes starting a recovery house easier. So the county government, we don't have planning and zoning authority. We don't do building codes. So all of that is the local units of government. But as we've had the dialogue here, we've got the community needs assessment. We've identified this a barrier to creating the pathway in the community. What can the county be doing with our electeds and with the administrative staff to collaborate with the other local units to, like, what can we knock out of the way? What can we do to open up the option for boarding room arrangements, for example, rather than a licensed home, or shared rooms where, Ms. Henry, you've elevated some of those sorts of barriers. So that's what I had to that point, Mr. Gladstone.
Understood. And I realize now, yes, understanding the functions of different governmental units, that the county doesn't have the ability to change zoning, because I think zoning is an issue. I don't know if county government can recommend to city and township governments, hey, we've discussed this in the commission and we would like to recommend that you take a look at your zoning and make it a little easier to get through the process to open recovery housing. But I just thought that question might be somewhat confusing as to what we're asking the county commissioners to do. So that's why I brought it to light, just to make sure that we don't confuse matters more. Like, like we did with the communications hub, but it gets kind of confusing. Who are we serving? Who's going to run it? Blah, blah, blah. So this question might get confusing also and have multiple views.
Sorry, Deputy Administrator.
Yeah, so I'll admit that this question number 2, when I was putting this together, I was trying really hard. Y'all had several meetings discussing this, and I didn't want anyone to not see their discussions recognized. So if there's a way that I can clarify this, I'd be happy to, because I was just trying to really amplify the robust discussion that y'all had over several meetings to this question in particular. I get that it's a lot of information, and maybe some of this is already spoken to in other components, so maybe we don't need the bulleted out points, or maybe we do. But I did want to point out a little bit farther along in that question, when you go to, in addition to the OCNA recommendation identified above, the task force also recommends, this is on page 3, the last bullet on page 3 speaks to looking at how the county could prioritize or other county grant funding programs such as housing millage, senior millage, veterans millage, by offering those match funding opportunities or prioritizing those applications that align with both funding streams. For instance, recovery housing is a critical need in Kalamazoo County. Grant portals like those for the housing millage should prioritize or offer matching funds to applications that address both housing needs and SUD-related recovery report, thereby maximizing the impact of available resources across multiple funding streams. So I tried to provide that actionable item to the list of the bulleted list above that was just a robust discussion that y'all were having. But this question in particular was very difficult for me to try to help recognize everything y'all were talking about, but also summarize it for the board in this report.
Director Rutherford.
So I do want to emphasize the importance of the word leveraging, because there's got to be an entity, or there's got to be somebody that's working on grant writing, so that we can leverage state and federal dollars that are ultimately and have been made available and will continue to be made available. It's just important that we take advantage of that, so that we can bring in as much resource as possible.
Thank you, Director Rutherford. Agreed. And I think the board did support we're bringing a formal grant writer on board to the county government, which hopefully will help in this. I'm going to continue down my stuff I have highlighted, unless there's other. All right, another, those same bullets we're kind of been talking through in question 2. One of them was about pregnant and postpartum supports. And we get here into the grid of this crosswalk, settlement E, and we have in our black and white copy, you have like a lighter gray and darker gray. The lighter ones, they're in blue in the draft report. Those are sort of seen as core strategies. And one of them under treatment, I just wanted to elevate because I've noticed we haven't talked about it much. Support for pregnant people is mentioned a couple times in the community needs assessment. We elevate that as well. But under treatment, also expressly expanding treatment for neonatal abstinence syndrome. So this is not just for the pregnant person or the mother postpartum, but this is for the baby in withdrawal. And so we haven't really elevated that, or maybe we just want to expand the language in our bullet question 2, or we don't. I just wanted to lift that up to see if we had thoughts from our task force on that one. Ms. King.
So this kind of also combines the housing piece to it, because we have very little housing for pregnant and postpartum women being able to have their children. And as the state's changing and removing children from their home if they identify as using substances, that's a piece that we need to look at. Unfortunately, a lot of times we see, especially women, being very resilient in unhealthy ways. So it doesn't look like they have a housing need. But when it comes to being able to make sure that they have and can keep their children, that's a huge piece that's missing that goes into that very delicate framework of that infant, especially coming out of and getting the treatment that they need for what they've been through in the pregnancy to be healthy, and supporting the mother as well without negativity.
Ms. Davis.
I guess I would encourage adding the wording just family treatment. Because that, I mean, I like the specific there, but also really looking at that family and providing that family treatment.
Thank you. And I know that it's elevated in our discussions, but maybe we could bring that forward a bit clearer within the recommendation report. Dr. Nettleton.
Yeah, just to clarify, neonatal abstinence syndrome is treated in the acute hospital care setting. And I'm looking at Exhibit E from the settlements, and it's on page E2. When it talks about expanding treatment for neonatal abstinence syndrome, it's focused on, I'll just read it, expand comprehensive evidence-based and recovery support, expand services for better continuum of care with infant and mom dyad, expand long-term treatment and services for medical monitoring of babies. I think because the treatment itself happens in the hospital, and I think what Nancy brought up and what Exhibit E is demonstrating is that, okay, then what? It's that wraparound continuum of care. So I think that's the spirit. Maybe we could consider copy pasting Exhibit E if the folks agree that that's the spirit of what is trying to be captured there. And on the corollary to that is there's an ongoing need nationally and locally for treating pregnant mothers who have moderate to severe opioid use disorder during pregnancy. And then that transition for the mom baby dyad, after delivery. So there is that educational component that we're working on, but it's a need, and that's on the mom side.
Thank you.
Thank you for that. So I think hopefully those are some good insights to sort of flush out what we're talking about with pregnant postpartum support. Deputy Administrator.
So that crosswalk is a crosswalk of Exhibit E, trying just to put it in a little bit better than like a 15, 20-page document. So I do just want to point out, though, I think some of the conversation y'all are talking about is listed under the social determinants of health column. There's a bullet there. It says address the needs of pregnant or parenting people and their families, including babies with neonatal abstinence syndrome. Again, I don't have Exhibit E in front of me, but y'all may want to consider the funding categories that y'all have put forward in this document is, let's see if I can find those percentages again. It does, basically what I'm trying to say, it does not currently include the social determinants of health category that's right here. So I don't know, just want to make sure y'all are aware of that. I believe we have 50% for treatment, 20% for prevention, 20% for harm reduction, and then 10% for recovery. Either we can modify those percentages or that crosswalk could be made differently. That would be something that I would probably need someone to take some assistance on because I am not the expert here of looking at Exhibit E and how those 3 bullets in particular in Exhibit E, where else they would fall into if we don't want to have that particular priority category.
Ms. Henry.
Just want to take a step back just a little bit for my own clarification when it comes down to providing grants and awarding grants to organizations to make sure that these things are provided to the community. A lot of times when I look at grants, in order for some of us to move forward or even provide services to postpartum women or pregnant women, does this funding allow for acquisition? Because if we cannot purchase things and we're only getting money to provide services, then some of the services will not be met if I cannot purchase a recovery home for women that are pregnant, that can stay more than 90 days, because 90 days is a Band-Aid. It's a good start, but they need to stay more than 90 days. So they may need to stay 6 months. Is there the ability and funding to purchase? Because a lot of grants don't allow us to purchase.
To make sure I'm understanding you accurately, specifically, you're speaking about purchasing the property in which to house the facility. Okay. And I think one of the things that thank you for elevating that. And because how expensive the cost of housing is, that's we're trying to look at those collaborations across our funding streams, like the housing millage, along with the opioid settlement, where maybe, if a grant comes in, proposal for a housing millage that's a postpartum recovery home, that gets a lot more points when we're looking at awards for the housing millage, because it meets, it crosses multiple efforts that we're trying to engage in, if that makes sense. I think that's what we're trying to sort of get at, because we could probably spend half of the money for the year on building the building or buying the building, right? I don't know if I'm speaking out of chair.
Thank you, Chair. I think that was a really good question. And I'm gonna go back to the mini grants because I've just seen a lot of applications from folks doing this work. There were a few applications where people were trying to acquire things, not necessarily a house, a car, a van for transportation. And it wasn't a whole lot of money to fit into that, but the funding didn't allow that. So that's a really good question.
Mr. Gladstone.
I concur. I think throwing these ideas for how we structure this out, because remember who we're talking to. We're talking to the Board of Commissioners, who is going to have the latitude to make the rules. So when we guide them, to give them the flexibility to do that is extremely important. We just got to remember not to add an extra level of confusion on top of it for them, because as many commissioners stated, they're not in the business of recovery. Some of us understand the recovery business and the addiction space, but it's not a sewer line, it's not roads and bridges. It's a difficult gray area for a lot of people to understand. So I think giving that latitude, families are extremely important, and I see a lot of lack of services. Thank you.
Dr. Nelson.
To your question, Deputy County Administrator, about carving out another box for the social determinants of health, one thing we could do is keep those 4 buckets that we've listed and those percentages, and maybe put within those buckets with special consideration for pregnant and postpartum people, and special consideration for criminal and justice involved persons, and addressing the needs of pregnant and parenting people. That way it highlights, perhaps it captures, the intent, and still is within those overall big buckets, and still meets the spirit, I think, of what is trying to be accomplished in Exhibit E. I don't know if that makes sense.
I believe so. So basically, I need to add a sentence here that these are the 4 funding categories that we're looking at for the next 3 years, but with special considerations for within the grant application for the 2 categories that you named.
So what he read out were the 3 bullets for under social determinants of health.
Okay.
And I like that recommendation. I think that makes sense for us. But I want to circle back to this dialogue from Ms. Henry and Chair Ray. Are there restrictions? And I know you're trying to type and also answer questions at the same time. So I'm so sorry, Deputy Administrator.
I would have to go back and read through Exhibit E as well as the settlement agreements. The spirit of the settlement agreements is for opioid remediation work. And then within there, they all usually align with Exhibit E, which outlines then, core abatement strategies and other considerations. I'll be honest, I'm not an expert within the Exhibit E document. So as far as like being able to know about tangible things being purchased.
Do you think the Michigan Association of Counties might be a good resource for you instead of having to dig in and learn it all on your own for us? Would they maybe be helpful?
Yes, and I think, I guess the question I have is, for instance, I believe, and again, I don't have it in front of me, but purchasing Narcan kits, that's tangible, that's within Exhibit E. I think what I maybe need to have a better understanding, and maybe I could get that, I hear housing and maybe purchase of land is a question. I think maybe if I could just get with Chair Ray and have some examples that she saw from the
Yeah.
mini grants, that might be helpful for me to understand how to pose the question correctly to Mac.
So like maybe vehicles was another one.
Vehicles, and then they talked about restrictions on like remodeling the homes, remodeling. I want to say it was a van that some folks were trying to remodel. There were restrictions on that as well. So
A quick point of info, you might want to try also.
Mr. Gladstone, just a moment, just let the chair call, but you may have the floor. Thank you.
Sorry about that. Thanks. I was just tracking with a deputy administrator there and the need for information. You might also want to try the Michigan Opioid Task Force that the governor has assembled, and emailing up to that office. I'm sure they're intimately familiar with all of the Exhibit E details.
Thank you. So one last thing that I had to elevate as well, maybe positioned prior to the conclusion, I think there was one point that we've kind of discussed a number of times is about advocating members of the task force potentially be able to work on the development of the scoring matrix that'll be used for grant applications, or maybe scoring of them be done with assistance from the task force, some of its selected members, or at least others with lived experience. So I know we took an approach where there were other community members with lived experience recruited to help score the mini grant process. But I know we've elevated that here a number of times. So I want to make sure that that lands into the report. Yeah, that's basically the gist of it. And I wrote some language that I could share with you for consideration to that point, but that we wanted sort of that ongoing input from people with lived experience as we get into the grant awards and development of the matrix and how we score. Okay. I feel like I talked way too much this meeting. I really don't want to be talking today. What else do we have?
I have a question.
Yes, Ms.
So when
Henry.
you talk about selecting people for the mini grant, how would you put that out for people to respond? How is that? How is it already, given out for someone to respond?
That's a good question. I think, Chair Ray, this time the selections were made based from the prior applicants for this task force that weren't selected. So they were already community members who had expressed interest and identified themselves as people with lived experience. But we would engage some sort of a public process like that. In some way, we'd either use applications that were gathered through a public process already, or we'd engage another one, would be my assumption. Ms. Davis.
I wanted to go back to a point that was brought up earlier today in talking about the public health campaign. And, would it be a better option to maybe contract with a firm that could come up with a public awareness campaign instead of putting that on, current staff and health educators?
Thank you, Ms. Davis. Mr. Gladstone.
Just to address that, I think the idea of having a firm do the design and implementation and all that is a splendid idea. What I have seen over the years, though, is if you haven't got people with lived experience designing the information, writing the copy, reviewing the copy at the very least, looking at the design, and saying that's going to work or that's not going to work, and respecting that. I've seen campaigns that I have flat out looked at and said, I can't believe they did that. So, when I saw the fried egg, this is your brain on drugs, all I could think of is I'd like some bacon with that. For the record, bacon is always good.
All right, so as we're coming to the last few minutes of our time, I think we have also other administrative updates. So I want to just ask again if there's any additional feedback for today. What we'll do, I think we'll get another sort of draft revision based on the additional dialogues today. And I encourage you, I have some written comments for Deputy Administrator, and I know she would value that from you if you maybe can, do a track changes review, and just from little things to the structure of content to additional insights that maybe we missed. If you could provide that, it would be appreciated and incorporated and valued. So let's plan to do that for our next meeting. And I think with that, I'm going to bring us to item 6, which is our administrative updates from Deputy Smith.
Yes, thank you. At this point in time, the only update I have, and I believe that the health educator, Kendall Conway, did share this out with the community-based opioid coalition, but and I will forward this out to the group. I know many of y'all sit on that, but MDHHS did kind of, going back to y'all's point, which I was kind of trying to quickly look through this if I could find an answer, but MDHHS did recently release a grant application opportunity. It's a competitive funding opportunity for providers to increase the availability of transportation services for individuals seeking or engaged in treatment, harm reduction, or recovery support services for substance use disorder. This is funding that is coming to the state of Michigan through the opioid settlements. So this is an opportunity that y'all have talked about quite a bit as far as leveraging funding, utilizing state funding to come down. It looks like the RFP has a max award of $200,000, and that application is due November 26th. So I will forward this out to the group in case y'all have not seen that. Like I said, I know Kendall did forward it over to about 60 plus people on that listserv that she has. So you may get this twice, but that never really hurts. But I'll be also looking at that just to see if they have those tangible items as well to have a response for y'all for the next meeting. I think one thing that might be helpful that you'll see changed in this draft report for the next meeting too is lots of great recommendations in here. It may be helpful for the board to kind of also see what is it that we're wanting to accomplish in 2025, 2026, 2027. I don't, just kind of like higher level of, yes, we want to release grant applications, but we would also like to have a focus on, setting up the admin support or making sure that that's set up or looking at the reporting tools, trying to detail some of that I think I hear y'all talking about that's embedded in this report, but I think a visual would be really good for everyone. So I will try to have that incorporated as well for the next draft report. And then the only other thing I'll add is that the Community Foundation, they are working through, they've selected the applicants for those mini grants. They're just awaiting for those official contracts to come back signed. And once we receive those signed contracts, then we will be releasing a statement to the community announcing who has received that funding and what those projects are. And so we're hoping to be able to release that by next week or the following. So hopefully mid-November, and that information, that those dollars getting out the door and doing some good work in the community. That's all I have.
Thank you, Deputy Administrator. Mr. Gladstone.
Thank you, Madam Chair. Quick question. When we present this board report, are they just going to get a paper document passed around to them, or is it possible that we have a brief, give them a chance to read it, of course, but then have a brief 30 to 45 minute session with the commissioners and with the task force to answer questions or clarify? Because we've had our own clarifications and we're in this ourselves. What if they have questions and they're looking at this report? So just a thought there. that we might want to have a meeting with the commissioners, some of which are participating, of course, in this, but the ones who aren't. So, yeah, we might want to do that. Thanks.
I think that's a good recommendation. The agenda setting is at the prerogative of the leadership team and the chair. But certainly it's, when we have lengthy reports, a PowerPoint presentation and the report and a dialogue would be, who doesn't, right? Let's make another one.
Lots of animation.
Oh, boy. All right, with that, all of you, your time is valued, your energy today, much appreciated. With that, we are adjourned.